Which is it? Is it really all about the money like so many people are so quick to say, or is it really more of a case of ignorance? And although a lot of my clients look very badly upon the medical community now, unfortunately, I really hate that. I used to go, they deserve it. They get they really get what's coming to them. That was my attitude 10 years ago. It's changed dramatically because I realized that I was one of them. For the first 20 years of my career, I was just like everybody else. I didn't know this stuff. I thought I was doing a good job. I was not somebody who was out for the buck. I've never been incredibly money oriented like some people accuse us of being. I just didn't know this stuff. I was ignorant, and so the question is, what is it? Is it ignorance or is it greed? Well, it's a combination of the two. And about a year and a half ago, I was in the shower where I do most of my great thinking. There's something about running water, Peter. You know what it is. There's just something about running water that brings you knowledge. I don't know. But I was under there and I was going, ignorance and greed. I would just talk about somebody about that. I said, that's what it is. And then I said, but there's a third element to it. And the third element is disobedience. Because I've told a lot of my clients about this and they're not doing it, either for themselves or their dog. Okay, so we have ignorance, we have greed, and we have disobedience, basically, people who are not doing what they know to do. And so I was mulling that over, and then all of a sudden I went, wait a second, no, it's because I'm into acronyms, I said it's disobedience, ignorance, and greed. That's dig. Yeah, we dig our own grave. How about that? And so I wrote that down, and I said I was going to give it to my pastor, and I never did. I thought he might be able to make a sermon out of it. But it's true. It's those three elements. We know that the power of money, and it's a very important thing. But I'm not the one. I'm not the one who's going to be the judge here. Of course, I just leave that up to the reader in those papers like that. But once we understand this stuff, at least we know we got to change it. And how we change it is the key. And you're doing the right thing, and hopefully I am by just trying to get this word out to people by doing TV shows, radio shows, websites, and this is going to be a change from the ground up. I think you've realized that, and so have I. That I've beat my head against the glass ceiling long enough. As far as I've written emails to doctors and people in neurology and this Mayo Clinic and stuff about my GARD diet. And I've gotten some interesting responses. But the way we're going to change this is by educating the masses.
And I think it'll be a big grassroots effort. I think it's already really started. I was actually at a seminar in Arizona about this time last year, and it was a seminar for doctors who were trying to change the way they practice. In other words, they were tired of, having to churn 50 or 60 patients through their office a day with a minimal.
To hear. What a great thing that there's a group of people like that. That's just awesome.
Yeah, and I actually got to talk to several of them, and it was really enlightening for me because I kind of had the same attitude, which is, you dig your own grave, you lie in it, right? Or you make your own bed, you lie in it. But hearing and seeing that, and you kind of, I will add one component to what you just said, and that is the social structure of healthcare. I think has influenced it largely too, because the customer get what the customer demands, and they get what they pay for. But I think with this whole managed healthcare system, the way it's changed the patient-doctor relationship, and the value of time in the patient-doctor relationship, it's become more about co-pays and less about patient care, less about listening to the patient, less about actually taking time to spend and examine and treat the patient.
That is so true.
And I think doctors, it's kind of evolved. So it started out with managed health care going to this new system, and it's just kind of evolved over the last 20 or 30 years, and now doctors are realizing they're looking back, and they've been making a living, and they've been, not doing, I don't think necessarily doing anything malignant to their patients, just maybe not spending as much time, as adequate amount of time as they could, because they've been stuck in this social trap. In order to survive, you have to accept insurance, but to accept insurance, these are the ways that you have to run your office. So this whole seminar was about how doctors can get out of that cycle and still make a decent living, but take good care of their patients.
Uh-huh.
So I just think that that part of that trend too, just to have a group that's out there that's going around the country teaching doctors these types of techniques. That just tells us that the grassroots effort is even more underway.
That's so true. That's what a great point. And as the other part to that too is the specialization of medicine. I over-exaggerate, of course, when I talk to my clients. That one of the benefits that veterinarians have, one of the biggest benefits I have in doing what I've done, is seeing the big picture. And as a veterinarian, I tell you, we do everything from toenails to brain tumors.
Mm-hmm.
Toenail trims to brain tumors, and I see it all. And when I look at my charts, all of a sudden when my eyes were open and I was seeing these patterns, and I was seeing not only the pattern in the individual, but the pattern in the collective, and they're coming in always the same time of year, and that's when I started getting into the seasonality of disease, which is just mind-blowing, the factors that tell us why we get sick when we do. Another question to ask, not only why are you sick, but why are you sick now? Why are you sick now on the calendar, and why are you sick now at this time in your life? And it's really fascinating. But the specialization of medicine has taken away that big picture from them, as you and I know. And so I tell people, you go to the doctor, and if it's your left kidney, you go to room 247. If it's your right kidney, you go to 248. Just to make a point. And it's because because of that, they've lost the grasp of this big picture. And one of my best friends, who's suffering from some major cardiovascular problems, he's in the vortex there because he's got 4 different doctors, and they were all prescribing for him. And he came to me, and I started looking at the drugs and looked at all the things that he was on. I said, you need to go see your pharmacist.